following program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.
Welcome to another edition of Community Health Matters. Today's show is dedicated to sharing information with North San Diego residents about living with diabetes, the last in our three-part series on this serious and increasingly common disease. Community Health Matters is produced by Tri-City Medical Center in cooperation with KOCT. I'm your host, Ricardo Berron, and I'd like to remind our viewers that this show is available in English and Spanish and also available online at koct.org. It's viewable on your iPhone, tablet, or desktop and easy to share with friends and family. Now, let's get started. In today's show, we will examine how can diabetes affect your overall health and how to deal with its effects. Getting informed and being proactive about your well-being can make living with diabetes a lot easier. My guest today for this first segment is Kim Pawson, Manager Center for Wound Care and Hyperbaric Medicine. Hey, Kim, thank you for being here with us.
I'm glad to be here.
Please explain how can diabetes affect the patient's visual health?
You know, diabetes affects a lot of our systems, and with the eyes, the visual health, some of the small capillaries, the smallest part of our blood flow, can be affected with diabetes, which affects the health and nutrition of the eye and the nerves. So that can really cause some change in the eyes as part of the systems that are affected by diabetes.
Does diabetes affect the immune system and therefore the ability to respond to a cold or a flu?
It does. The immune system of the body is the part of the body that fights infections and it fights off the flu. And because of high levels of sugars, that's impacted in the bloodstream. And so it makes people with diabetes, if they have small injuries or they're exposed to infections, the diabetes makes it harder for us to fight that off. So the better that we can keep blood sugars under control and the diabetes under control, the better the immune system's strength will be.
And speaking about infections, it is specifically important for people with diabetes to take care of their feet. Is that correct?
Absolutely. That's a huge thing that we're focusing on at the Wound Center and the Hyperbaric Center. I know that you're going to be speaking with Dr. Willard later today.
Yes.
That's one of the big things we focus on because some of the sensations, people can't feel their feet as much. There's some nerve changes. Skin changes really puts people with diabetes at risk, not just for injuries to their feet, but actually going on to amputation and some big problems. So that's one of the things we're going to talk about preventing.
Wow. What are the most common skin complications that affects diabetics?
A lot of times because diabetes causes dry skin, the nerves aren't stimulating the skin to excrete normal oils that we would have. The skin is more dry. And with that, it makes it easier for cracking. And with the lack of sensation, maybe you wouldn't notice as much. So keeping skin supple, protecting it from cracking, dryness, scratching would be a big thing to keep an eye out for.
People with diabetes are prone to experience tooth and mouth problems. What can they be?
That is an interesting thing. We've found that people that floss their teeth, our dentists are always telling us to floss. Yeah. But in diabetes, it is so important, it can actually lower somebody with diabetes hemoglobin A1C, and that's how they measure how well their sugar's under control. So if they pay attention to even flossing, that makes their whole system, body system better. Without doing that, because diabetes can also cause dry mouth, our saliva actually helps prevent tooth decay, and with dry mouth from diabetes, we see a lot of dental caries, cavities, and even tooth loss. A lot of people actually get diagnosed of having diabetes while they're at the dentist.
So, but how can they tell? Let's say if they're in their house.
Bleeding gums is number one.
Okay.
Bad breath is another thing, and dry mouth. So that every 6-month appointment at the dentist, truly important.
Is there any other health suggestions that you can tell them to maintain an oral health?
The brushing and flossing, of course. There are liquids out there that your dentist can help you with, but they're over the counter that are for dry mouth. And keeping that mouth flushed out really makes a difference.
Kim, earlier you talked about diabetics having a high risk of foot amputation. Yeah. Can you expand on prevention diabetics for foot wounds?
Sure. We're part of the Save a Limb, Save a Life Foundation, and at the Center for Wound Care and Hyperbaric Medicine, some of the things that we do for prevention is number one, education in foot screening. So teaching patients how to look at their feet and know that they need to. We always ask them to look at the bottom of their foot. They should be looking for any calluses, any red marks, any areas that are warmer or colder than the other areas, any cracks. They need to look between the toes, because a lot of times another one of the skin problems that diabetics can get is fungal infections, and that happens between the toes. That's a big entryway for bacteria and fungus to get in and cause an infection. We had talked about how the nerves change with diabetes. That makes people not have the same sensation. So when they're walking, they may not feel that there's a pebble in their shoe, or that their shoe is rubbing in a different way. You and I would start limping after a while or go, I'm not going to do that anymore. They need to wake up every morning, tap their shoes on the floor, make sure there's nothing in there. Are their shoes wearing differently? We've had patients come into the clinic that have actually walked on our beautiful beaches, but on a hot day, sand can really gain a lot of heat. And we've had people that burn the bottom of their feet, so that we've actually had to treat them for burns. So education about prevention, what to be really careful about, is a big focus.
And you're focusing right now, there's actually a huge campaign here at Tri-City about that, right?
There absolutely is. One of the things that we're doing is providing posters that go in all the physicians' offices in the Tri-City area. And it says, if you have diabetes, take off your shoes and socks. And normally everyone's like, no, don't take off your shoes and socks. And we're like, no, do take off your shoes and socks. Because if you haven't noticed, and let's face it, it's hard to look at your feet sometimes when we get to a certain age or lack of ability. The doctors can look at your feet and say, oh, I noticed this is happening. We can do something before it becomes infected. We also want to check your circulation, because you have to have good blood flow. And that's another thing that we see sometimes with diabetes, is a lack of blood flow down to those feet. So when you come in, we want to check. We want to ask you, are you having any pain when you walk? Do your calves hurt? Do your thighs hurt? Can you only walk a certain amount of distance and then you have to stop and rest? Well, that could tell us maybe you're having some blood flow problems. If we address that earlier, we're going to prevent all kinds of problems.
Great information. Thank you, Kim. We have to take a short break, but we'll be right back with more Community Health Matters. Don't go anywhere.
To keep your mind energized and healthy, learn a language, take a new route to work, or brush your teeth with your less dominant hand. These are easy ways to help activate your brain's biochemical paths and strengthen brain circuits.
Young lives need air,
Well, what's in you is really what's around you.
sun, water, and all the riches of the earth to bloom and thrive. Growing bodies and minds grow better
Lots of worms in here!
when they connect with nature every day. Open your door. Visit Nature Explore at arborday.org for the young lives in your life.
It has to do with the whole being outside thing.
The American Dream. American ingenuity. American craftsmanship. American justice. American perseverance. And the very idea of America itself. Colonial Williamsburg is an important piece of America that everyone should experience.
Welcome back to Community Health Matters. I'm your host, Ricardo Berron, and today's topic, diabetes. Wound care is an important aspect of living with diabetes. A stubbed toe is just painful to the average person, but it can turn into a life-threatening injury if a person with diabetes is not careful. In this segment of Community Health Matters, we will be speaking about the Center for Wound Care and Hyperbaric Medicine at Tri-City Medical Center, and we will explore the importance of taking care of wounds caused by diabetes and how to treat them. I'm joined today by Dr. Gary Willard, Medical Director of such center. Thank you, doctor, for being here with us. Why is wound care so important in diabetics?
Well, diabetics have immune compromise. Their immune system doesn't work as well as someone without diabetes. So wounds often get infected and become very problematic.
And now, can you list the top 3 measures a diabetic should take into account in order to prevent wounds?
The number one issue is controlling the blood sugar or the blood glucose. So diabetic control, glycemic control is very important. The second would be foot care, proper hygiene, inspection of the feet, since this is the most common area of our wounds in the diabetic patient. And third would be proper shoe wear. So you have to have the proper shoe fit, otherwise you end up with wounds.
Can you please describe, doctor, the main type of wounds suffered by diabetics?
Well, any wound can be a problem with a diabetic, but the wounds that we see most commonly are foot wounds. We call them diabetic foot ulcers, or diabetic wounds of the feet. These are the problematic wounds that continue to give us trouble and lead to other problems with amputation and progressive disease.
How should a diabetic then treat a wound?
They should really identify the wound. If they have a wound, if it doesn't disappear in a few days or it's not getting better, they need to see their doctor, especially on the foot. The foot is the big problem. So any diabetic with a foot ulcer or a foot wound should seek medical help.
And why, doctor, so many diabetics experience amputations of a lower extremity in those cases?
Okay, so 15% of patients with diabetes end up with a diabetic foot ulcer. That's a wound on the foot. 15%, or 15 out of 100 of those patients go on to amputation. So the commonest cause of amputation and lower extremity amputation, over 100,000 a year in the United States, is caused by diabetic foot ulcers.
What signs should a patient that has a wound should look for in order to know if they need medical attention?
Pain, redness, weeping wound, fever, chills, or a wound that's not improving, continuously improving over a week to 10 days.
Can you please explain, doctor, how does an individual chamber of hyperbaric oxygen therapy work and what it can do for a patient?
Well, hyperbaric oxygen therapy increases the amount of oxygen in the blood. It's the high levels of oxygen, 10 to 15 times the amount that normally you can breathe in, that makes the difference. And these high levels, it increases bacteria killing of these bacteria that cause the problem. It helps new vessels form in the lower extremities to fight infection. And the increased oxygen also helps antibiotics get to the wounds.
Can other conditions benefit from this hyperbaric oxygen therapy?
Yes. We use hyperbarics in radiation injury, patients that have had head and neck radiation for cancer, develop problems, patients with prostate cancer that end up with radiation develop problems. So probably the second leading use of our hyperbaric chamber is actually radiation effect or post-radiation effect of patients.
Treating a chronic non-healing wound can be frustrating and time-consuming. What advice can you give to patients with this type of wounds and or the caregivers?
Well, we involve home health a lot for our diabetic patients because most of them can't take care of their wounds. They can't get to the bottom of their feet. So we involve home health. We see them in the wound center. And physicians in the community also involve home health to assist in care. They need that. These wounds are very problematic, and it's hard for a patient to take care of their own wounds.
And you have a wound care center right here in Tri-City Medical Center, is that correct?
Yes, we do.
What does it make it so unique?
It's unique because it's designed to take care of the community wound patients. We have physicians that are certified in wound care and hyperbaric medicine. We have staff that are well-trained and experienced in wound care. And it's all about taking care of these patients. And they need this kind of care.
Can you please describe the type of treatments at the wound care center?
Well, a patient is generally referred to us by a physician in the community. They'll see their physician with a wound that's non-healing. After an attempt at treating those patients, they send them to us. And we have a center that is set up to take care of all these complex wounds. Patients are brought in, insurance is verified, we do accept insurance, and insurance pays for wound patients. So we see the patients in the front. The physician does an intake, actually kind of complete history and physical of a patient. You know, we don't just look at the wound, we want to know what's going on in their lives, how's their diabetes, what's happening, are they taking care of themselves? And then we hone in on the problem, the wound. And when we see a patient with a wound, we do wound measurements, we'll do wound cultures to make sure that we're going to treat this patient appropriately if they are infected. We ask for blood tests, we look at the whole system. If x-rays are needed, we order x-rays for the patient. It's all done through Tri-City. We also will do MRIs, special studies if we're looking at bone infections. And sometimes it takes a week or two before we know exactly what's going on with that wound. In the meantime, we're treating that wound. So initially, we treat with medications, we treat with different ointments that we feel appropriate, silver products that we use for wounds that help kill bacteria. So we're trained to take care of these wounds in a multifaceted area.
Can you walk us through a typical day at the wound care center?
Yeah, so we're open from 8 to 5. So the physicians get there early. We actually have hyperbaric patients.
Okay.
In that facility, we have a room that's designated for hyperbaric oxygen therapy. Those patients are treated, we'll treat anywhere from 4 to 10 patients a day in hyperbarics. A physician is absolutely, it's necessary for that physician to be there during the whole treatment. The wound patients are treated, we have 5 or 6 exam rooms that we actually can see patients in. Our staff are well trained, they room the patients, prepare the patient for the physician, and then we go in, like any doctor office, and we see the patient.
Will insurance cover this type of treatment, doctor?
Absolutely. All of our patients are insurance-based. It is an insurance-based program through Tri-City. So both secondary insurance, primary insurance, Medicare, most of the patients we see are Medicare or other insurances, HMO insurances will accept as well. So most of our community patients that are seen in the hospital can see us in the wound center.
I've heard you had great results with this hyperbaric oxygen therapy, and patients are not in there for a long time, right?
Well, it's a daily treatment, 5 days a week, and most of the time they're 40 treatments, so it's like an 8-week program. And while they're in the chamber, it's a 2-hour procedure.
That's not bad.
No,
I think nobody will suffer from.
No, it's a great treatment. Great treatment.
Thank you, doctor. Very, very informative. We have to take another break, but Kim Poston will be back to talk about proper nutrition for people with diabetes. We'll be right back. This is Community Health Matters.
Calories are a unit of energy, and your body needs them to work properly. Most foods and drinks contain calories. For example, 1 gram of fat contains 9 calories, and 1 gram of carbohydrates, 4 calories, the same as protein. The key to managing weight is to keep a healthy balance between the calories you consume and the ones you burn off.
many uninsured Americans are receiving free eye exams that may save their sight. Eye Care America's Glaucoma Eye Care program offers eye exams for those at risk for glaucoma. The program is for U.S. citizens or legal residents who have not had an eye exam in a year or more and are determined to be at risk. Those eligible receive a free eye exam. To learn more, call 1-800-391-EYES or visit www.eyecareamerica.org.
All smiles are not created equal, but animals take what they get. Luckily, you can turn to an orthodontist who has 2 to 3 years of specialized education beyond dental school. Visit an orthodontist for a lifetime of healthy, beautiful smiles.
Welcome back. I'm your host, Ricardo Berron, and you're watching Community Health Matters. Dealing with diabetes shouldn't be a permanent burden. Fortunately, there's many ways to cope with this disease and continue enjoying the activities we like. Less stress, healthy eating habits, exercise, and a regular care routine are the best allies for diabetic. I'm joined again by Kim Poston, manager at the Center for Wound Care and Hyperbaric Medicine. Hey. Kim, thank you for being here with us. How does being fit and physically active contribute to diabetics' quality of life?
Well, of course, all of our lives are improved by being fit and physically active. With the diabetic in particular, exercising increases muscles. And muscle mass is where the fuel from the sugar or carbohydrates that we eat every day, muscles is what burns it. It's also what lets us use our insulin better. So what our bodies are producing or what we have to inject if we need additional, that being in shape makes the machine run better. It's kind of keeping our car tuned up.
Does diabetic people need a special equipment to exercise?
Not really. One thing I would point out, it happened to one of my patients that was trying so hard to get everything right. And we had recently healed the patient up from having a diabetic ulcer on their foot. And they were going to exercise and bought a little biking machine. What many people with diabetes don't realize is with the decreased sensation in their feet, shoes don't feel the same way as they did years ago. So that when she went to tie her shoes and make sure they were nice and snug, actually she had gone out and bought a pair of shoes that were too small. Wow. By the time she could feel them, they felt okay to her. So you want to make sure that your foot is measured and that you buy that size. Never over tie the shoe, because all of us, when we're being efficient, titled to, oh, I'll just tie that bow. We don't want to make things too tight. And that the shoes are deep enough so that they're not smashing on top of the toes. Slow and steady and regular is the way to do it. We have people lift bottles of water. You don't have to go out and buy a whole new fitness machine. And walking is great. Walking doesn't have hard pounding exercise, but over time it builds our heart muscles and our lungs, and it's a really good exercise.
Now, can you give us a type of diet diabetics should follow?
Yeah, we want people with diabetes, as all people, to have a healthy diet, to have enough of each kind of food that they need. Obviously, vegetables, fruits, and meats, and people tend to think, oh, well, but people with diabetes can't have carbohydrates. You should have enough carbohydrate, a healthy meal, and we can help with that. That's one of the things that Tri-City does have as a nutritionist, to put those things together and help you do that. The body needs fuel, and fuel for the body is carbohydrate, so we have to have enough. We can't have too much of it. It'd be like putting gasoline not only in our gas tank, but also in the oil and in the windshield wiper and in the air conditioning. We don't need too much of anything. That's what breaks the car down, but enough. So healthy, balanced meal and regularly spaced meals.
Well, does reducing mental stress help better control a person's blood glucose levels?
It does, and I tell you why.
So I see everybody stressed nowadays.
We are. It's our lifestyles, and this is how you can figure that it would matter to you. If you're stressed out, your heart starts going, and we call that the fight or flight. If a tiger's going to bite on you, either you're going to run away or you're going to fight the tiger, and that makes your system really revved up. That burns calories, And that makes your body go, oh, your body needs sugar in its symptoms, so you're always dumping sugar into your system. Too much sugar. We don't need it. So if we can get ourselves to a little better place by reading, by exercising, by just doing things that are pleasurable to us, we don't dump as much sugar into the system. And that's why mental stress, taking care of that helps.
How can family members help diabetic patients?
I think we always talk about being supportive, and I'm as guilty as the next person. When I support my husband on a diet, that means I'm a nag. Oh, you can't have that. And that's not support. Yeah. Being there to share meals, to share activities, to go to doctor's appointments and listen and learn, help people manage their lives, but maybe not be the nag that some of us are.
Is it true that it's fine for diabetics to drink diet sodas?
Oh,
that's a myth.
There's a lot of talk about that, and the jury is still out. There is some indications that non-sugared beverages would make it, oh, well, I still can have the sweet, but there's some evidence that shows that it makes people more resistant to insulin. And I would say that water is a great thing, and that we know that water is good for you, and we don't have to wait for the studies to come back and say, well, because these beverages, we're studying them, yeah, just drink water.
And what about alternatives for sugar, like blue agave, honey, or other artificial ones in powder?
Calories are calories.
Okay.
And so by looking at things in moderation, so with a diabetic diet plan, there's things that you can have as long as you build it into your daily plan of how you're going to manage your meals for the day.
But is there a best sweeter, natural, or that a diabetic can take that you recommend?
Not that I would recommend. I would talk to my own endocrinologist and see what they feel like the recent studies would show on that.
Well, thank you, Kim.
Okay.
That's all the time we have for today's informative program on diabetes. I want to thank also Dr. Willard from Tri-City Medical Center, and of course, Kim Poston from the Center for Wound Care and Hyperbaric Medicine, who were our experts in today's final program in our three-part series, Diabetes. Thank you to our viewers for watching this episode of Community Health Matters. Remember, you can watch this and many other programs anytime by going to koct.org. You can even share it with friends and family. And please do, we have many great health services available right here in North County. I'm your host, Ricardo Berron, and this has been Community Health Matters. God bless you.
Posture is more than looking poised. When you slouch, so does your spine, which can affect circulation and cause vertebrae to deteriorate over time. Bad posture also affects your muscles and joints, potentially resulting in pain and exhaustion, limiting the range of motion over time.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.